Well, Rhinelander is full of historic buildings, but the downside to older towns is that lead can be found in buildings and outdoor sports equipment. So here to teach us all about the dangers of lead poisoning is our very own Nurse Christina. So good morning, Christina.
Hi, good morning.
Good morning. So we want to start out with the basics. What exactly is lead poisoning?
So lead poisoning, when we think of lead, we think of metal pipes, but really lead can be found in things like dust, wall paint, old toys, especially those that come from other countries, pottery, old pottery, soil, and drinking water. So what happens is lead gets into our systems. We take them in by ingesting or inhaling, and they compete with other metals that are really important to the body, like calcium, zinc, iron, and copper. And then what happens is it starts to affect our brain and our brain's ability to control impulses and to process information. And it's more prevalent in children than in adults because adult bodies have ways and have developed ways to naturally protect itself from lead.
Sure, yeah, it's a very serious situation overall, and there's many ways that you can kind of get lead poisoning, so it's good to know a few of those factors. But we want to know, what are the factors that could increase the risk of lead poisoning?
So absolutely, like I said, age. It's more prevalent in children, ages 1 or infants to 5 years old. Living in older homes, we have these beautiful historic homes and rustic cabins in our area, so you have to be really careful because the pipes and the paint in those older homes could be traced with lead. It was really prevalent in paint back prior to, I think it was 1976 when they stopped that. Certain hobbies, up here we're big fishermen and hunters. So old fishing lures had lead in them. Also, there were lead shotgun shells. So people who are into reloading shells or hunting, it's not a bad thing. You just want to kind of be careful around your children. Maybe wash your hands after using those products. And then that was the hobbies. Yeah. So we just have to be really careful.
Sure. So what are some symptoms that people can watch out for, whether they're kids or adults?
So symptoms. So children, you're looking at developmental delays, learning disabilities, maybe irritability, weight loss. They might have abdominal pain or even some vomiting. Now that's pretty extreme, probably not seen as much here in our country. But also in adults, you might see something more like high blood pressure, joint and muscle aches, and memory and concentration problems.
Gotcha. And so we want to know, too, are there treatments for lead poisoning? Can it get better for people?
So there is a treatment, a chelation treatment, that you would need to talk to your doctor about, but it's basically taking medicine that helps pull the lead out of your body. That's really, again, for extreme cases. One of the big things that you can do is just make sure that you're eating a diet rich in calcium, vitamin D, vitamin C, and iron. So things like milk, yogurt, fortified cereals, fish, lean meats, oranges, tomatoes, and they're all yummy things to eat, so that doesn't make it that hard, but increasing that intake.
Gotcha. Okay, so real quick, Christina, how can you at home prevent lead poisoning?
So the things that you want to do, wash your hands and wash your toys. Make sure that if you get toys from overseas, I know when my children were little, they had the Thomas the Tank Engine trains that had come from China and were found, to have lead in them. So just any wooden toys that are painted, things like that, you want to make sure. Clean and dust surfaces. Use a HEPA filter in your vacuum. Take off your shoes before entering the house. And actually, with what's going on right now, that's the best thing you can do anyway. Run cold water for at least a minute before drinking if you're staying at the old cabin. Kind of turn the pipes on before you start to use that, or buy bottled water. And then prevent children from, playing around things that if you see paint peeling or chipping on the walls. And you can talk to your public health department or your provider if you have any concerns.
All right, Christina, a lot of good tips there. We really appreciate it for you talking about such a serious topic today. Thank you so much.
Absolutely. You all have a great week.
All right, you too. Thanks so much.